Question 1. In a context of radiation protection hysteresis, a nuclear medicine technologist who is preparing for a routine procedure involving a highly radioactive source. The procedure requires a prolonged exposure time of approximately 30 minutes in close proximity to the patient. Given the circumstances, what is the most appropriate method for minimizing hysteresis radiation exposure during this procedure? A. Increase the shielding around the patient. B. Decrease the time spent near the patient. C. Increase the distance from the patient. D. Reduce the exposure to the patient by limiting the radiation dose. Answer. Correct answer. B. Decrease the time spent near the patient. Explanation. The principle of LARA, as low as reasonably achievable, is key to minimizing radiation exposure. Decreasing the exposure time is one of the most effective ways to reduce dose, as the amount of radiation a person is exposed to is directly proportional to the time spent near a source. Increasing shielding or distance can also reduce exposure, but reducing time is often the and most practical measure in such scenarios. Radiation safety regulations, such as those from the NRC and ICAPI, emphasize minimizing exposure time, distance, and shielding as primary protective measures. Question 2. Which of the following is true about the role of positron emission tomography (PET) in nuclear medicine? A. PET is only used for cardiac imaging. B. PET scans can provide functional and metabolic information in addition to anatomical details. C. PET imaging primarily uses technetium-99 meters as a radiopharmaceutical. D. PET is not used in oncology applications. Answer. Correct answer. B. PET scans can provide functional and metabolic information in addition to anatomical details. Explanation. PET scans are unique because they can provide functional and metabolic information about tissues, unlike conventional imaging techniques, which primarily focus on anatomical details. This is particularly useful in oncology, as PET can detect abnormalities in metabolism such as increased glucose uptake by cancer cells. While technetium-99 meters is commonly used in SPECT imaging, PET typically uses radiopharmaceuticals like fluorodeoxyglucose (EDD), a glucose analog, to assess metabolic activity. PET is essential in oncology, neurology, and cardiology. Question 3. When analyzing the potential effects of radiation on human cells, which of the following best describes the impact of ionizing radiation on DNA? A. Ionizing radiation only causes temporary mutations in DNA, which are always repairable. B. Ionizing radiation can lead to both single and double strand breaks in the DNA, which may cause permanent mutations or cell death. C. Ionizing radiation exclusively leads to the formation of free radicals, which have no impact on cellular DNA. D. Ionizing radiation has no significant effect on DNA. Answer. Correct answer. B. Ionizing radiation can lead to both single and double strand breaks in the DNA, which may cause permanent mutations or cell death. Explanation. Ionizing radiation has enough energy to remove tightly bound electrons from atoms, creating free radicals and ion pairs that can damage DNA. This can lead to single or double strand breaks in the DNA molecule, which may result in mutations or cell death if the damage is not properly repaired. The damage can also lead to cancer development if mutations occur in critical genes. The cellular repair mechanisms may attempt to fix the damage, but if the repairs are unsuccessful, the effects could be permanent. Radiation protection guidelines, including the ALARA principle, are designed to minimize such DNA damage. Question 4. Considering the evidence from multiple studies, what is the primary advantage of using a gamma camera in nuclear medicine imaging? A. It provides both anatomical and functional imaging data in a single procedure. B. It is effective for imaging only bone scans. C. It can distinguish between different tissue types in high detail. D. It requires minimal radiation exposure compared to other imaging modalities. Answer. Correct answer. A. It provides both anatomical and functional imaging data in a single procedure. Explanation. A gamma camera is designed to detect gamma radiation emitted by radiopharmaceuticals within the body, and it provides both functional, metabolic, and anatomical information. This dual capability is what makes gamma cameras valuable in nuclear medicine procedures such as bone scans, myocardial imaging, and brain scans. Truism-specific imaging, such as for bone scans, is more commonly associated with gamma cameras Their versatility in providing both anatomical and functional insights is the main advantage. The use of other imaging modalities, such as ET or MRI, is sometimes combined with SPECT or PET for more detailed imaging. Question 5. Which of the following is a characteristic of the quality control process for nuclear medicine imaging equipment? A. Quality control ensures that the equipment is only tested after a malfunction occurs. B. Quality control is unrelated to radiation safety and patient care. C. Regular quality control checks are vital to ensure optimal imaging quality and radiation safety. D. Quality control is primarily focused on the aesthetic appearance of the images produced. Answer. Correct answer. C. Regular quality control checks are vital to ensure optimal imaging quality and radiation safety. Explanation. Quality control QC in nuclear medicine is crucial to maintaining the accuracy and reliability of imaging equipment. Regular UC checks, such as those outlined in the OPM, American Association of Physicists in Medicine, and NRC regulations, ensure that imaging systems are functioning optimally. It helps to provide clear images while also minimizing radiation exposure to both patients and personnel. Poor QC can result in suboptimal images, leading to misdiagnosis or unnecessary repeat scans, thus increasing radiation exposure. QC is critical for both imaging quality and safety. Question 6. When considering the biological effects of ionizing radiation, which of the following is true regarding chronic exposure to low doses of radiation? A. Chronic low doses of radiation do not cause significant biological effects. B. Chronic exposure to low doses of radiation may lead to delayed effects such as cancer, cataracts, and genetic mutations. C. Chronic low-dose exposure is only harmful to the patient but not to the medical personnel. D. Chronic exposure results in immediate acute radiation sickness. Answer. Correct answer. B. Chronic exposure to low doses of radiation may lead to delayed effects such as cancer, cataracts, and genetic mutations. Explanation. Chronic exposure to low doses of ionizing radiation does not typically result in immediate acute effects, but it can lead to delayed biological effects, such as an increased risk of cancer, cataracts, and genetic mutations. These delayed effects are more concerning in settings with repeated exposure, such as in healthcare professionals. The ALARA principle is designed to minimize chronic exposure to radiation, emphasizing the need to limit time, increase distance, and use shielding. Regulatory bodies like the NRC and ICA provide guidelines to mitigate these risks. Question 7. Mr. Smith is preparing to undergo a renal scintigraphy procedure to evaluate kidney function. Which of the following is most important to ensure accurate results from the radiopharmaceutical used? A. The radiopharmaceutical should be injected immediately before the scan to minimize decay. B. The patient's hydration status should be disregarded to simplify the procedure. C. The dose of radiopharmaceutical should be reduced to minimize radiation exposure regardless of accuracy. D. The patient should be positioned in the same manner as for all other scintigraphy procedures. Answer. Correct answer A. The radiopharmaceutical should be injected immediately before the scan to minimize decay. Explanation. For accurate renal scintigraphy results, the radiopharmaceutical needs to be injected at the appropriate time to ensure it reaches the kidneys without excessive decay. This is important as the decay of the radiopharmaceutical can affect the image quality and accuracy of the scan. Hydration status is also crucial in renal imaging as it can influence the distribution of the radiopharmaceutical, but it should not be disregarded. Radiation exposure should always be minimized in accordance with ALARA, but not at the cost of diagnostic quality. Question 8. In a scenario where a technologist is handling a radioactive source, what is the primary radiation protection measure that should be employed to protect the technologist from radiation exposure? A. Use of shielding to absorb radiation. B. Using a personal dosimeter without altering the exposure time. C. Increase the amount of time spent handling the radioactive source. D. Direct exposure to the source while wearing lead gloves. Answer. Correct answer A. Use of shielding to absorb radiation. Explanation. Shielding is one of the most effective methods to protect against radiation exposure by placing shielding material, such as lead or concrete, between the radioactive source and the technologist. Radiation is absorbed, reducing the amount of exposure, increasing time spent near the source, or direct exposure should be avoided. Personal dosimeters help monitor exposure but protect against radiation. The goal of radiation protection is to minimize exposure to radiation through proper safety measures such as shielding, using distance, and limiting exposure time. Question 9. Considering the importance of proper patient care in nuclear medicine, which of the following best describes the patient's role in preparation for a thyroid uptake scan? A. The patient must fast for 24 hours before the procedure to improve uptake efficiency. B. The patient should avoid iodine-containing foods for a week before the scan to prevent interference with radiopharmaceutical uptake. C. The patient must undergo a full-body scan prior to the thyroid uptake procedure. D. The patient's hydration status does not impact the results of the thyroid scan. Answer. Correct answer. B. The patient should avoid iodine-containing foods for a week before the scan to prevent interference with radiopharmaceutical uptake. Explanation. Proper patient preparation for a thyroid uptake scan involves ensuring that iodine from external sources, such as iodine-containing foods or medications, does not interfere with the radiopharmaceutical's uptake in the thyroid. This is because excess iodine in the body can suppress the ability to take up the radiopharmaceutical effectively, compromising the accuracy of the scan. Fasting is generally not required, and hydration status can affect certain nuclear medicine scans, but it is not critical for thyroid uptake. Question 10. When analyzing the regulatory standards for radiation safety in nuclear medicine, which of the following statements is most accurate regarding the handling and disposal of radioactive materials? A. Radioactive waste should only be disposed of by incineration, regardless of type. B. Radioactive waste can be disposed of in regular trash bins as long as it is securely packaged. C. Disposal of radioactive waste must comply with NRC regulations, including proper labeling and storage procedures. D. Radioactive waste does not require any special disposal procedures as it is non-hazardous. Answer. Correct answer. C. Disposal of radioactive waste must comply with NRC regulations, including proper labeling and storage procedures. Explanation. The disposal of radioactive waste is heavily regulated by the NRC, Nuclear Regulatory Commission, and other governing bodies to ensure public safety and environmental protection. Radioactive materials must be disposed of following stringent guidelines, including proper store, labeling, and disposal procedures. Incineration is not a universal disposal method and is not suitable for all types of radioactive waste. Regular trash bins are not an acceptable disposal method for radioactive materials due to the health risks they pose. Special handling and disposal procedures are required by law. Question 11. Given the circumstances where Mr. Davis, a nuclear medicine technologist, is working with a patient undergoing a thyroid scan, he must be cautious about radiation safety. The patient's dose has been prescribed based on the ALARA principle. Which of the following is the most appropriate action Mr. Davis should take to minimize radiation exposure to both the patient and himself? A. Use higher energy radioactive isotopes to minimize the total volume of injected radiopharmaceutical. B. Ensure the patient is well hydrated before the procedure. C. Utilize shielding for both the patient and the imaging equipment during the procedure. D. Encourage the patient to remain in the scanning room for a prolonged period to ensure optimal results. Answer. Correct answer. C. Explanation. The ALARA, as low as reasonably achievable, principle aims to minimize radiation exposure by using appropriate protective measures. Shielding for both the patient and imaging equipment is critical in reducing exposure. This principle emphasizes both time and distance. The Mr. Davis should not encourage prolonged scanning or unnecessary energy use. Hydration is important but does not directly minimize radiation exposure. Question 12. When performing a SPECT scan for cardiac imaging, octa read encounters a discrepancy between the expected biodistribution and the actual results. What could be a potential cause for this issue? A. The radiopharmaceutical may have been improperly labeled. B. The gamma camera was incorrectly calibrated before the procedure. C. The patient failed to follow the fasting instructions before the scan. D. The room temperature was too high during the scan. Answer. Correct answer. A. Explanation. A discrepancy in biodistribution is often a result of improper labeling of the radiopharmaceutical. Incorrect labeling can affect the ability of the drug to target the intended organs, leading to poor imaging results. While fasting instructions are important for patient preparation, improper labeling directly impacts biodistribution and scan accuracy. Question 13. In the context of radiation safety, a nuclear medicine technologist is tasked with managing the disposal of radioactive waste. Which of the following methods is most appropriate for disposing of contaminated materials? A. Place all contaminated materials in a regular waste container for later pickup. B. Use a designated radioactive waste container and follow the institution's disposal protocols. C. Incinerate the contaminated materials on site in an open facility. D. Store the materials in an unsecured area until proper disposal is arranged. Answer. Correct answer. B. Explanation. Radioactive waste must be handled and disposed of according to strict institutional protocols. A designated radioactive waste container ensures proper containment and minimizes environmental contamination. Incineration and improper storage could lead to radiation exposure and contamination. Using regular waste containers is unacceptable and violates safety protocols. Question 14. Mr. Smith, a nuclear medicine technologist, is preparing a patient for a bone scan. He notices that the patient is pregnant. According to radiation safety guidelines, what should Mr. Smith do next? A. Proceed with the bone scan as usual, ensuring the patient is shielded. B. Cancel the procedure and suggest a different imaging modality. C. Perform the scan only after obtaining informed consent from the patient regarding radiation risks. D. Administer a higher dose of radiopharmaceutical to compensate for the pregnancy. Answer. Correct answer. C. Explanation. The radiation safety guidelines emphasize the importance of considering pregnancy before proceeding with any nuclear medicine procedure. Informed consent is crucial, as the patient needs to be fully aware of the potential risks. Shielding is important, but the procedure should be reconsidered based on the patient's condition. It is not acceptable to proceed without proper consent or higher doses. Question 15. In an effort to enhance image quality, Dr. Johnson has adjusted the acquisition parameters for a PET scan. Which of the following changes is most likely to improve both resolution and sensitivity of the scan? A. Increasing the scan duration and reducing the number of frames. B. Decreasing the number of coincidence events recorded during the scan. C. Increasing the resolution at the expense of sensitivity. D. Optimizing the energy window and reducing the attenuation correction. Answer. Correct answer. D. Explanation. The optimization of the energy window and attenuation correction is critical for balancing image resolution and sensitivity in PET scans. A narrower energy window helps to reduce noise and improve signal-to-noise ratio, enhancing both image quality and sensitivity. Reducing the number of coincidence events or compromising resolution negatively impacts the image quality. Question 16. In terms of radiopharmaceutical chemistry, which of the following best explains why a radiopharmaceutical may be inefficient at targeting specific tissues? A. The radiopharmaceutical may have been synthesized with too low a specific activity. B. The radiopharmaceutical may be too highly radioactive, causing unwanted tissue destruction. C. The radiopharmaceutical may have been administered without patient preparation. D. The radiopharmaceutical may have been over-diluted, reducing its effectiveness. Answer. Correct answer. A. Explanation. Specific activity is a measure of the radiopharmaceutical's radioactivity per amount of substance. If the specific activity is too low, the radiopharmaceutical may not be concentrated enough to effectively target the intended tissues. Over-dilution, insufficient patient preparation, or high radioactivity are not as directly linked to targeting issues as specific activity. Question 17. The radiation dose to a patient undergoing a renal scintigraphy procedure needs to be carefully calculated. What factor is most important when considering the appropriate dose for such a procedure? A. The patient's age and body weight. B. The radiopharmaceutical's half-life. C. The imaging equipment's sensitivity and resolution. D. The patient's kidney function and clearance rates. Answer. Correct answer. D. Explanation. Renal scintigraphy involves assessing kidney function, so the patient's kidney function and clearance rates play a critical role in determining the appropriate radiopharmaceutical dose. The patient's age and weight can influence dosing, but kidney function directly affects how the radiopharmaceutical will behave in the body, impacting the scan's effectiveness. Question 18. Which of the following is a critical aspect of quality control for nuclear medicine imaging equipment? A. Ensuring the equipment is cleaned daily, regardless of use. B. Performing daily quality checks to assess the uniformity of the imaging system. C. Calibrating the imaging system only once a year. D. Replacing detectors after each scan session. Answer. Correct answer. B. Explanation. Daily quality control checks are essential to ensure the imaging system's performance remains optimal. These checks help assess uniformity, resolution, and alignment of detectors, all of which are necessary for accurate results. Cleaning equipment is important but is not the sole factor in quality control. Annual calibration is too infrequent for maintaining accuracy. Question 19. Considering the biological effects of ionizing radiation, which of the following statements is most accurate when describing acute radiation exposure? A. Acute exposure primarily causes genetic mutations in somatic cells. B. Acute exposure leads to the rapid development of chronic radiation effects. C. Acute exposure typically results in tissue damage to rapidly dividing cells. D. Acute exposure to low doses of radiation is harmless and does not require any medical attention. Answer. Correct answer. C. Explanation. Acute exposure typically causes immediate damage to rapidly dividing cells, such as those in the bone marrow, gastrointestinal system, and skin. This can lead to symptoms like radiation sickness. Acute radiation exposure does not necessarily cause chronic effects immediately, and low doses may not cause immediate harm but still require monitoring and precaution. Question 20. During a pediatric nuclear medicine procedure, a technologist must adhere to specific guidelines to reduce radiation exposure. Which of the following practices best supports radiation safety in pediatric imaging? A. Use the same adult radiopharmaceutical dosage for pediatric patients. B. Decrease the imaging time to minimize radiation exposure. C. Administer the maximum allowable dose to ensure optimal image quality. D. Avoid shielding the patient as it may obstruct the imaging process. Answer. Correct answer. B. Explanation. In pediatric nuclear medicine, reducing exposure time is essential to minimize radiation risk. This can be done by optimizing scan duration and adjusting parameters without compromising image quality. Pediatric doses should always be adjusted based on weight, and shielding is important to protect surrounding tissues. The maximum allowable dose should never be administered in excess. Question 21. A nuclear medicine department is introducing a new PET scanner. As part of quality assurance, which actions should be prioritized before patient imaging begins? A. Review and update all patient consent forms with the new scanner specifications. B. Perform phantom studies to evaluate spatial resolution and system sensitivity. C. Conduct a staff meeting to introduce the scanner's software interface. D. Schedule regular maintenance before using the scanner on patients. Answer. Correct answer. B. Explanation. Phantom studies are critical in quality assurance to ensure that spatial resolution, sensitivity, and calibration of the new scanner meet clinical standards before scanning patients. While staff training and consent form updates are important, phantom imaging ensures the scanner's performance and safety first. Question 22. During a lung ventilation perfusion scan, the perfusion images show a segmental defect in the lower lobe while ventilation appears normal. What is the most likely clinical interpretation? A. Pulmonary embolism. B. Chronic obstructive pulmonary disease COPD. C. Pulmonary edema. D. Lung cancer. Answer. Correct answer A. Explanation. A segmental perfusion defect with normal ventilation, i.e. ventilation perfusion mismatch, is classic for pulmonary embolism. In contrast, match defects are seen in COPD or pneumonia. Lung cancer typically causes mass effect, not perfusion mismatches. Question 23. A technologist notes that the radiopharmaceutical administered to a patient is significantly past its expiration time. What should be the immediate next step? A. Proceed with imaging if the dose activity remains sufficient. B. Administer a new dose only after notifying the radiation safety officer. C. Inform the supervising physician and document the incident. D. Cancel the scan and reschedule the patient without informing anyone. Answer. Correct answer. C. Explanation. The supervising physician must be informed immediately and the incident should be documented according to protocol. Administering expired doses or hiding the incident can breach safety and legal requirements. Radiation safety officers may be involved afterward, but informing the physician is the first step. Question 24. 5-year-old patient is scheduled for a renal scan. Which factor should primarily guide the radiopharmaceutical dosage? A. The estimated glomerular filtration rate (GFR). B. The child's height and weight-based dosage chart. C. The renal scan protocol used for adults. D. The time since the last contrast-enhanced CT scan. Answer. Correct answer. B. Explanation. Pediatric patients require dosage calculation based on standardized height and weight-based protocols. E.g. EMOR-MMI pediatric dosage cards. Adult protocols are not suitable for children due to increased sensitivity to radiation. Question 25. After injecting Tc-99 meters MDP for a bone scan, a technologist notices redness and swelling at the injection site. What is the most appropriate next action? A. Continue the scan and monitor the patient for delayed reactions. B. Elevate the limb and apply heat to the site. C. Notify the supervising physician and document a possible infiltration. D. Inject the remaining dose at a different site and proceed. Answer. Correct answer. C. Explanation. Redness and swelling may indicate infiltration, meaning the radiopharmaceutical did not enter the circulation properly. This must be documented and the physician notified to determine whether the scan should proceed or be rescheduled. Question 26. Which of the following best describes the purpose of using a collimator in a gamma camera system? A. To reduce scatter radiation entering the detector. B. To convert gamma photons into visible light. C. To amplify the signal received by the photomultiplier tubes. D. To enhance the radioisotope's decay rate for faster imaging. Answer. Correct answer. A. Explanation. The collimator restricts the direction of incoming gamma photons, allowing only those traveling in certain directions to reach the detector. This improves image resolution by reducing scatter. It doesn't affect decay rate or signal amplification. Question 27. A patient undergoing thyroid ablation therapy with I-131 must receive post-procedure radiation safety instructions. Which is the most critical instruction to reduce radiation exposure to others? A. Drink plenty of fluids for hydration. B. Sleep in a separate bed and use separate bathroom facilities if possible. C. Limit phone use and screen time for 72 hours. D. Avoid consuming seafood and iodized salt. Answer. Correct answer. B. Explanation. The primary concern is minimizing radiation exposure to others, especially from body fluids. Using separate sleep-in and bathroom facilities is essential in the first few days post-therapy due to excretion of radioactive iodine. Diet is important for uptake, not for post-treatment radiation safety. Question 20. In nuclear cardiology imaging, what is the role of a gated aspect acquisition? A. It filters motion artifacts caused by patient breathing. B. It synchronizes image acquisition with cardiac electrical activity. C. It enhances perfusion uptake in myocardial infarction zones. D. It monitors respiratory rate and depth during imaging. Answer. Correct answer. B. Explanation. Gated SPECT imaging is synchronized with the ECG to capture cardiac motion throughout the cardiac cycle. This allows evaluation of wall motion and ejection fraction, critical for assessing cardiac function. Question 29. A technologist is preparing to perform a Gus-67 scan on a patient. Which preparation instruction is most appropriate for the patient? A. Remain NPO for 12 hours before injection. B. Avoid dairy products for 48 hours post-injection. C. Undergo bowel cleansing or laxatives before imaging. D. Stay upright for 1 hour after injection to prevent reflux. Answer. Correct answer. C. Explanation. Bowel activity can interfere with GUS67 imaging due to its excretion route. A bowel cleansing regimen or laxatives are commonly recommended to reduce abdominal tracer accumulation and improve diagnostic accuracy. Question 30. During a whole body bone scan, the technologist notices asymmetric tracer uptake in the ribs unrelated to known pathology. What could be a benign explanation for this finding? A. Diffuse metastatic disease. B. Improper camera calibration. C. Recent physical trauma or rib fracture. D. Equipment malfunction during image reconstruction. Answer. Correct answer. C. Explanation. Rib uptake can occur due to recent trauma, fractures, or even muscle strain. Such findings should be correlated clinically. Metastatic disease would typically have additional sites. Equipment or calibration issues would usually affect the entire scan, not focal areas.